I'm Cierra Bettens. Welcome to APTN News, InFocus. This week, we're putting Jordan's principle in focus. For nearly 20 years, the federal government has been running a program called Jordan's Principle. The program is supposed to provide First Nations children living on reserve with the same supports and services children living off reserve could receive. It's named after Jordan River Anderson, a boy from Norway House Cree Nation who was born with multiple health issues in a Winnipeg hospital. For him to go home, a number of services would have to be in place. But Canada and the province of Manitoba continually argued over who would pay for them. In the end, Jordan never made it home. 20 years after his death, the program is, well, in shambles. And it seems no one can tell what services are and aren't covered. Our Parliament Hill reporter, Karyn Pugliese, joins us now to unravel what's going on. Thanks so much for joining us, Karyn.
Oh, thanks for having me.
So last week, Indigenous Services Canada unveiled some significant operational changes to Jordan's Principle. Can you bring us up to date?
Yeah, so they came out with a statement. The minister made a statement, and then they put out a bulletin saying that they're no longer going to pay for certain things. And on the list were things like purchase or construction, renovations of homes, request to support sporting events or elite or competitive sporting events or related training, and modeling headshots, just some of the things on the list. And, you listen to some of these things and you go, well, that's quite shocking. What do you mean you're building homes? Like, what do you mean you're renovating homes? Like, isn't this supposed to be a health service for children? But I mean, when you think about it, these things could have like real meaning behind them. They could, it could be a kid who's now in a wheelchair, who's had an accident, who now needs a ramp for their home. So that could be the renovation. So they said that they'll no longer pay for such things unless funding is required by substantive equity and unless they're linked to specific health, social, or educational needs of a First Nations child, which sounds fair. And some of the things are kind of like just hard to bend your head around. Like, under what circumstances would a modeling headshot ever seem to be related to a child's health or an equity of service? So, it was quite a shock when the list came out and you're trying to bend your head around it.
Mm-hmm. Yeah, in some of our APTN stories, we've seen requests for medical transportation and accommodations get denied by the program. And then, you see these seemingly non-essential items like modeling headshots and zipline kits getting approved. Do you think there's any sort of reasoning behind this that I guess we could glean?
Well, I guess one of the questions that's come up is like, is the system being abused? And the interesting thing is that back in December, chiefs in Manitoba had an emergency meeting about Jordan's Principle. Partly they were really concerned with the backlog. A lot of them had been going out, paying out of pocket for services, and then they're running into these things that they themselves said they thought some people had been abusing the system. Some of them talked about having Jordan's Principle workers in communities being approached by parents who were very aggressive and wanting services for their kids. They said they felt like Jordan's Principle had gotten so broad that there were really no guardrails on it, or there was no way to say no. And one of the chiefs even said he himself felt like he may not get reelected if he denied some of these services. And so they had their own concerns, saying that they felt bullied, and they had their own questions about what was being approved. And one of the really interesting things that came up in that meeting is Rod Graham, who is the acting regional executive officer with Indigenous Services Manitoba, told the chiefs that he said, "We know there's some challenges with scope on some cases. One that the minister mentioned is someone in one of the communities got approved for the elite hockey school of $5,000. Is that in scope?" And so it did seem like some of the things that were getting improved were sort of out of scope. The chiefs talked about they felt like they were set up to fail through this program. And I don't know if they were set up to fail, but certainly when that list came out, people were looking at, chiefs and communities thinking, what are you doing? But we have to remember that ISK has the right to deny these things. So what was ISK doing approving them? I've got that question into ISK. Haven't had an answer back yet. I'm waiting.
One of the terms that you brought up earlier was this term substantive equity. And that's a term that Jordan's Principle administrators use a lot. Can you maybe give our listeners an idea of what that means exactly?
Well, really, yeah, Jordan's Principle, as you mentioned, was set up for Jordan River Anderson. And, when they first started defining Jordan's Principle, what happened was they kind of got the government to go along. They got Gene Crowder, who was an NDP MP in 2007, to pass a motion through the House saying that they would support Jordan's Principle. And the idea there is Jordan had these multiple disabilities. He was caught between provincial and federal jurisdictions, as you mentioned in the beginning, not willing to pay for it. And any other kid in Canada who's not First Nations would have had those services. The problem is that the federal government, was saying, well, we shouldn't pay because he's off reserve. And when a First Nations kid is off reserve, it's the province who pays. And the province is like, no. First Nations kids, he's going home to reserve. The federal government should pay. And so it created this idea of inequity, but there's other inequities too. There was a point in around 2013, where they had defined, the government had defined Jordan's Principle so narrowly that you had to be a kid exactly like Jordan. You had to be caught in a jurisdictional crisis where people were arguing over who would pay. You had to have multiple disabilities impacting your health. And it was in fact so narrow that the government was able to say there are no existing Jordan's Principle cases. But this idea of inequities, as the First Nations Child and Caring Society kept taking the case back again and again before the Human Rights Tribunal, saying kids need to get services, is this idea that a First Nations kid should be able to get services on par and on level for health, just like any other kid in Canada. And so it broadened the scope of Jordan's Principle. And this is one of the reasons we see there's backlog. It's no longer about disabilities. You don't any longer have to be normally resident on reserve. It's gone from like pure healthcare to also including things that make sense like food security, which is health related. And so you'll see people getting gift cards for groceries through Jordan's Principle, for example, to feed their kids. So that's what's kind of meant by that term.
Mm-hmm. And so another thing was back in 2022, Indigenous Services Canada mandated a new back to basics approach for Jordan's Principle. And this really seemed like a turning point in how the system was working. Can you talk a bit about, that turning point and what were some of the consequences of it?
Yeah, I mean, like even like some of this terminology, I just feel so bad for the parents who have to go through the system, because there's all this jargon, right, that just normal people don't know. I know that you were doing some reporting on back to basics, and I had to really do a lot of reading to even understand what it was. At a very basic level, the idea was that they were trying to get rid of paperwork and streamline the system so that parents could get care for their children faster and without having this enormous amount of paperwork. So it did a few things. So it allowed parents to go ahead and apply for services with less paperwork. For example, they didn't have to go and find out what the cost of the service was going to be up front, which would be something that you can imagine. Your child needs a service, you have to go and somehow find information on how much it's going to cost. So you didn't have to do that anymore, which was sounds like it was a terrible burden. And it also allowed something else. It allowed the requester, the person asking for the service, or the professional suggesting the service, to determine whether or not it was urgent before ISK used to do that. And once it was determined that it was urgent, people in Indigenous Services Canada couldn't lower it. They couldn't say, no, it isn't. And so they saw a huge increase in urgent requests. I have a figure here that in 2022, Indigenous Services Canada identified 5,800 requests, which is about 18% of the requests that were coming through, that they didn't think were urgent but got marked urgent. So things like laptops and desktops and computers and software, tablets, printers, They had modeling headshots in there listed as urgent. If you imagine people standing in line in an emergency room in a hospital, they have a way of triaging the stuff, right? Where they say, if you've been shot, you go to the head of the line. If you've got a cut, you go to the back of the line, like you wait longer. But there was no way to triage this anymore because everything that got marked urgent, they weren't able to lower the urgency level of it. And it started plugging up the system. So you had kids who were waiting for computers ahead of maybe a kid who needed urgent hospital care. And it started adding to delays.
Part of the vision of Jordan's Principle was to, reduce these bureaucratic and administrative barriers to get First Nations children access to services. But now with these operational changes, it seems like there is at least a bit more paperwork involved or, getting more references or letters of recommendations from health professionals, educational professionals, or elders. Do you, foresee this maybe creating more barriers, these new changes?
Yeah, I mean, they're leaving the Back to Basics program, and they've got the list of things that they will not approve. I mean, one of the things that I heard from chiefs again and again, particularly in Manitoba, is that they were told to go out and spend, spend, spend. So a lot of them fronted money on things. There was a chief who mentioned that he spent $1 million on a Jordan's Principle building. And so I've tried to follow up with these chiefs to see, well, where are you at? Is your program going to continue to be funded? Are you going to get your money back? And we're hearing from chiefs who are confused themselves. They don't know if the programs that they're running are now going to continue to be funded. They don't know if the money they spent is going to be repaid. And so they can't answer the question themselves. And of course, I've got questions into ISK, but I already think that Indigenous Services Canada is going to come back and say, well, we can't comment on a case-by-case basis or something. We're reviewing the applications. And that's fine. That's fair. That's exactly what they would be doing right now. So yeah, it seems like it's going to be a little bit harder for people to get services. It seems that some services may be cut or put under review. And the line that they had in their bulletin read, "Funding should not be spent unless approved first through Jordan's Principle. Previous year's expenditures or deficits that have not been previously approved are not eligible for reimbursement under Jordan's Principle." So what does that mean for the communities that went out and spent money because they had a kid or children waiting in line for a program, were told to spend, 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 and thought they were going to get the money back? Are they going to be reimbursed or not? And no one knows.
So do you think, the cracks in the Jordan's Principle system are indicative of, something larger?
Yeah, I think it is. I think it's indicative of two things, right? One is just as you know, some communities have just been starved for programs. And so I was talking to the First Nation Child and Caring Society. I was talking to Brittany Matthews. And one of the things that she said was that when you talk about jurisdictional, it's not always just the province or the feds. It's gaps in programs. And so some of these programs, as they started running, became more social. Like I said before, about food security. Maybe there was a breakfast program for kids or something like that the community started to run, which if you think about it is a health issue. It is a genuine health issue. And there may be programs out there, and this is something that Valerie Gideon, who is the Deputy Minister in the Department of Crown and Indigenous Relations, talked about in an affidavit before the Human Rights Tribunal. She had said, well, there's already programs out there. So if somebody is looking for, say, food, need food supports, well, they shouldn't really be on this more than a year because there's other programs over there that they should go to. Then what the Caring Society said is yeah, but that's the problem. So it seems like they don't even agree on, what Jordan's Principle is or what kinds of things it should be funding. So they're still very far apart on that. They always have been. So I think it's one, they define Jordan's Principle differently, the different parties who are administering it, and they've never come together on that. Two, there's these long gaps in the community, whether it's on education or health services, or even emergency services like operations that are just, like not properly funded or inaccessible that need to be filled. And people are jumping in and saying, well, we finally get a chance to offer breakfast to hungry children. Like, we should be doing that. And then the other thing is the way that this whole program was Frankensteined. I mean, like, I'm not a policy expert by any means, but my God, I know this is not the way that you're supposed to make a policy, where you keep running to a human rights tribunal and getting orders to force your partner to go to the next step. And so you get this like horrible hacked together program that's issued by legal order after legal order after legal order, when it probably would have been so much better to just sit down and hash it out and agree to what you were going to fund and what the definitions were going to be. But we didn't see willing partners willing to do that. The federal government, through the Paul Martin years, through the Harper years, through the Trudeau years, kept trying to offer the most narrow definition possible. And chiefs, the AFN and the First Nations Child and Family Caring Society, who were leading this, kept pointing to gaps and inequities, like for First Nations children that needed to be closed. And the tribunal kept siding with them. They kept winning. And so these orders would go back and the government would be forced legally to take the next step. And it just made for a terrible way to put a program together.
So, with these new changes, where do we go from here?
I mean, I don't know. I have a feeling that there's going to be more probably going back to the tribunal. I think just for the next stories that I'm going to be working on, and my colleague Annette Francis, who everybody knows from the television world, who reports for the television news of APTN, we're going to be looking at a kid who has fallen through the cracks. It had already fallen through the cracks, and now it's looking less and less hopeful. I think we're going to be seeing a lot of service delays. Aside from the new rules, one of the other things that Indigenous Services Canada was trying to do was they were moving everything from the regions to national, which kind of tells me that they thought the problem with approvals was at the regional level and they wanted more control over it centrally. But that is leading to longer waits and longer waiting periods. From Kitigan Zeeby, I saw a memo come out from their Jordan's principal worker that said, regionally you wait 6 months if it's a regional approval, which now is restricted only to really pure health issues. Anything else like renovations, etc., that is more nuanced has to go to national, and you're going to be waiting a year. So we're going to see those things. I think the next stories that we're going to be following is once chiefs know what happens to the programs that they've been running. We're going to be looking at canceled programs, and we're going to be looking to see if First Nations spent hundreds of thousands, in some cases millions of dollars, that they're never going to get back again. And then what happens to those communities? Because they were robbing Peter to pay Paul. So we don't know exactly what's going to happen there, but that could, for some communities, if they don't get paid back, be disastrous.
I want to end, I guess, with a question on, how is this impacting, the people that are directly affected by this program, which is, First Nations children and their families?
Yeah. To be honest, I don't know if they felt the impact yet. I think they're going to feel the impact if programs are canceled. But I have seen at least one memo from Saskatchewan Health Services, and we've been reaching out to them, where they were funding since 2023 a food and infant support program through Jordan's Principle. And as of August 2024, they haven't received any payments, and they're still owed $2.5 million, says the memo. So they've met to talk about how this is going to affect the community. And a senior management official from Jordan's Principle told them that they should not spend any more money without approval, which was different than the original plan. So that may be one of the first programs that we kind of see fall through. But those are the kind of things that I'm expecting to see. Jordan's Principle officials going and telling chiefs to stop spending now. And for these programs that have been anchored, well, what do the kids do? The kids go back to where they were before there was a program. I guess, like in terms of a food and breakfast program, they go back to not having breakfast.
Well, thanks so much for joining us, Karyn, and giving us, a bit more of a deeper perspective into what's happening with Jordan's Principle, because it's certainly difficult to navigate everything.
Yeah, well, thank you for having me, and I appreciate being here.
Karyn Pugliese is APTN's Parliament Hill reporter, and you can follow her work by visiting aptnnews.ca. This episode of InFocus was produced by Mark Blackburn and Charmaine Straker, with editing by Jesse Andrushko, and hosted by me, Cierra Bettens. If you're enjoying the show, let us know by leaving a rating and review. You can find more APTN podcasts like APTN News Brief and Truth in Politics on aptnnews.ca/podcast or on your favorite player. Thanks for listening.
Hi, I'm Dennis Ward, one of the hosts of APTN National News. We've expanded our Truth in Politics panel into a weekly podcast. Each episode, panelists Jennifer Leywitz and Nigon Sinclair join us to examine key issues affecting Indigenous peoples across Canada. Listen and subscribe on your favorite podcast player.